So one of the things is that people call our office, right? And they ask like a very elementary question like, how much does it cost, right? As you guys know, for sure my assistants know, as we do our surgeries, right, there are like complications that happen that you would never ever think would happen. And that is even at the end of surgery, right? During surgery, something that you would have never thought can happen, and it happens. So you tell me, if you're a patient, right, and you are in need to have the surgery, the first thing I would say, do you even understand how complex what we do every day is? It's literally life and death. We do it in a dental office, right? But it's literally life and death. I'll give you an example. As much as taking a tooth out. You take a tooth out, there is some sort of blood vessel that's there that we didn't see, that we would have never known. It's not on the CT scan, it's not anywhere, and boom, it starts to bleed. And most people over 40 are taking a baby aspirin. And in some patients, their baby aspirin works as much as a real blood thinner, and their bleeding doesn't stop. Now, do you want the guy who's doing it for really, really cheap, who probably just started because he doesn't understand these complications, to manage you? Do you want to go away in an ambulance? Do you want to go, God forbid, in a body bag? You know, it's quite harsh. But implant dentistry, especially full arch implant dentistry, is not a joke. It's a discipline that requires full scope surgery understanding, full scope prosthetic understanding, full scope laboratory understanding, and it's not for the faint-hearted. And if you're a patient and you call and you say, how much is it? As opposed to, how much experience does he have, right? Does he understand my medical history? Does him and or her and the anesthesiologist that are going to be having their life, my life, in their hands, like, do they understand this? And these are like, when they call our office, these are questions that they should say. We're like, well, I want the cheapest, or this guy does it for cheaper. Well, do you understand the procedure that you're having done, right? Do you understand that this is something that needs to be done right, and needs to be done right the first time? How many times do we take out implants that were poorly placed? How many times do we take off crowns that were poorly done? How many times, and forget the way that it looks or the way that it fits, but the things that you can't see. When people say, well, I have implants. Well, do you know that the implants are placed like that? And there needs to be heroics to put things put together. And again, I could say, just even yesterday, we did a case. Complication happened. We need to be able to manage it. We managed it, but you need to have a team. You need to have experts that can deal at the time of stress to be able to do this, because these things happen. Implant dentistry is not your traditional dentistry. It's not what you look for, what your insurance is going to cover, what Medicaid is going to pay for you. This is high level, high technical skill, high stress for the doctor to be able to do this perfectly, easily for you, so that you go home with teeth, and you go home with teeth that last a really long time. So when patients call, these are the conversations that need to be had. Like, what is the experience you're looking for? If you're looking for someone straight out of school that probably did 10, 20, 30 cases, we're not the place for you. If you want the best care to be able to manage anything that possibly happens in the office, then this is the office for you. And because of that, you're going to have to pay for it.